Hi, Jasmine.
Hi.
I'm Dr. Torkian. It's nice to meet you.
You too.
Since your reconstruction, how's your nose doing?
It's really hard to breathe. Like, it's hard for me to breathe and eat at the same time. It's very difficult to live like that.
Have you had your teeth replaced?
No, everything was just ripped apart.
Sometimes you feel, why me?
I feel,
Yeah?
Yeah.
Well, let's take a look. Do you have pain anywhere in your face right now?
Just in my jaw area.
Breathe in really deep for me. Does that help? When I hold it open like that?
Yeah.
And then breathe in again.
That hurts.
The main things that I saw in her nasal cavity was a tremendous amount of scarring that resulted in closing off of the airway. There's something in here, we'll have to review that.
This was so swollen. It was really hard.
It's not an uncommon way to heal in the upper lip. At this point, she has some things that can't really have been addressed in that hospital situation. The inside of the nostril normally was about this big.
Right.
This healing process has made it contract down to about 1/3 of its size. The most difficult thing to correct is going to be the nostril symmetry. The second is the nasal bridge. The nasal bridge is basically smushed to bits. One of the things that's standing out now is that the upper lip has lost a little bit of its support, so it needs to be a little bit more forward. This is one of those situations in which you know you could have lost the person, but then to see them suffering, it hits them every time they see her.
We're now joined by Dr. Torkian, and I just want to say thanks for seeing Jasmine. We really appreciate that.
Thank you. It's an honor.
And the biggest question, doctor, this is your area of expertise, facial reconstruction. Is there hope for Jasmine?
Absolutely. There's 3 things, bullet points that I see in the nose. Primarily the breathing, which is the scarring inside the nostrils. This is just a consequence of the way things heal. As you know, when you're healing in a suboptimal condition, things tend to really tighten up and scar down and really contract a lot. Releasing some of those contractures, possibly placing a little bit of tissue from the ear, maybe cartilage, maybe some skin along with it from the ear in order to help open these things up. Performing some scar revisions along the nose and also along the nostrils in order to help the nostrils become a little bit more even in size will help a lot.
What's going through your head right now?
I don't know, just a lot of emotions. It's really hard to look back at everything and relive all that again.
But with Dr. Torkian in front of you, you went through the trauma of this event, and obviously, and I agree with you, applauding all the doctors who did that emergent work. But the hope, because Dr. Torkian, he knows what he's doing, and he's got a plan in place, and I think he has a plan even further than that.
Definitely.
In terms of making this happen.
Because part of healing you on the inside has to do with what you see in the mirror. These are all reminders. I'd like to help you, and I'm going to do this for free. I'm going to do it at no charge. I'm going to take good care of you. It's going to be okay.
How does that make you feel? Some hope?
Yeah, amazing. Something that I never would have thought I ever could have done.
And you know, Dr. Torkian, we can't thank you enough. Obviously, Jasmine, you know, you're dealing with a lot of issues, and we're going to share more of her story when we return.